Inter-island registration begins, and how prepared are you for the fast-approaching hurricane season? Good morning, everyone. I'm Akush Lapinder, and this is your morning edition. As the world emerges from lockdowns and restrictions relax, there is increasing concern about the possibility of a second wave of COVID-19 gripping the world. Well, that's one of several questions we put to Deputy Chief Medical Officer DeLon Brennan this morning.
Persons are definitely desirous of getting back to their, some might consider their normal lifestyle, because it's such a different challenge that we have going on to what our normal activities are. And so we do have to address those needs and letting people know why it's so important that we continue with some of these activities while we are trying to transition as well. In areas where we have challenges, we need to have restrictive measures, and in those, we have to show actively that we are relaxing those measures in areas where we don't see as many challenges. If we don't do it, then we see in areas like Germany and other countries who relax measures early, they're starting to see a second wave of infections, even in China, where they had done a great job at really minimizing the spread. Now that they're beginning to open up the economy again, you're seeing a second wave. So we can see that example happening in other places, and so we have to be wary of what those challenges might be and how we can mitigate against them.
And checking the dashboard, recovered cases jumping from 43 to 42. Is this an anomaly?
No, what we see sometimes is that there are patients who had an opportunity to be considered as recovered, and then they may have symptoms or they may end up with a challenge. And, you know, we've had people who have chronic non-communicable diseases and they end up going back into hospital. And in those instances, we need to make sure that they aren't continuing to have complications due to COVID. So we may remove them from a recovered status back to an active status so that we can kind of pay attention to it. So we're watching it closely, and, you know, it's a very fluid situation in our recovered versus not recovered cases. But things are progressing, and we're tending to, once people get recovered, that they stay in that status.
It's now day 2 of the 2-week lockdown in Bimini. What are health officials on the ground saying?
The evidence that we've seen so far is that the people in Bimini have taken the lockdown seriously, and we're seeing that they are paying attention to the protocols, and that the streets are fairly empty. People are staying within their domiciles. You know, essential workers are out making sure that if people have needs when it comes to food or healthcare supplies or security, that all of that is being taken care of. So far, we're very pleased with what's going on in Bimini, and so we hope that it continues to progress for the next 12 days for them.